today we'll be talking about how to correctly give insulin and why it's so important. There are several side effects that can happen if you incorrectly give your insulin. One of those being low blood sugar, which is also known as hypoglycemia, and that is when your blood sugar level is under 70. Signs and symptoms of these may include drowsiness, confusion, irritability, shakiness, and irregular heart rhythm. Another side effect is high blood sugar. That's also known as hyperglycemia. That's when your blood sugar is above 126 after 8 hours of not eating, no food, or over 200 2 hours after you've eaten. Signs of hyperglycemia include headaches, thirst, trouble concentrating, and blurred vision. And then another more severe side effect is diabetic ketoacidosis, and for this one you need to be able to check your urine for ketones with strips, and if you see that it is positive or a high amount of ketones, it's important that you contact your healthcare provider immediately. This happens when you have very high blood sugar in your body and acidic substances, which are the ketones, are building up to very dangerous levels. So signs of this may include excessive thirst, nausea, frequent urination, confusion, abdominal pain, fatigue, and fruity scented breath.
Alright, so now I'm going to be showing you how to actually properly give your insulin and the steps that you need to follow when doing this. So first, you have your insulin pen, you have an alcohol swab, and you have your needle. So the first step is to take your needle. You want to take off whatever covering there is and screw it on to your insulin pen. And then you have to take the plastic cap off. And there's usually a second protective plastic cap that you also need to remove. So you want to take that off as well to expose the needle. Once you do that, you want to dial up the correct amount. And you do that by twisting this knob. So I'm going to dial it up to 4, and this actually has half units on it, so I'm dialing it to 4.5, since it's in between the 4 and the 5. And then next, I'm going to open up the alcohol swab that I have. And common sites for injection are usually fatty areas that include the thighs and the abdomen. So just for filming sake, I'm going to use my abdomen. But you want to pinch the skin and clean it with the alcohol swab. And then after that, let the alcohol, let it dry. And once it dries, just double check you have the right amount one more time. Insulin can be very dangerous if given incorrectly, as we already said. So then inject straight into the skin and then push the plunger down with your thumb until it goes all the way to 0. Hold the pen in for about 10 seconds to make sure that the entire dose is administered and absorbed. And then after that, you can remove it from your skin. And then after you remove it from your skin, you also want to remove the needle. And you do that by putting the cap back on and unscrewing it the other way. And then you can recap your pen with just the plastic covering. And then you want to properly dispose of the needle because this is a biohazard and you don't want it to stick anybody else. So that's the importance of correctly giving insulin and how to give it.